My name is Jesse Wright. I am a colorectal surgeon, and I work at a Baptist at both Shelby County and DeSoto County. My father and my grandfather were both surgeons, and so I grew up in a household where surgery was a routine part of dinner conversation. Getting just to be immersed in that culture and that day-to-day activity just was so fascinating. In my particular line of work, people do often ask, why would you go into a specialty where you're taking care of people's butts? To that answer, I say everyone needs a proctologist and everybody poops, which is the same conversation I have with my children during their potty training days. Ailments of the backside, very sensitive topic no one likes to talk about, but having someone who can both offer a thoughtful and appropriate ear to the situation and take care of these problems really are some of my most gracious patients, because it is a problem that can control their quality of life and day-to-day being. Graduated from medical school in 2013 at Vanderbilt, so 11 years, but been in practice of surgery and colorectal for now 3 years. I get to be with a patient from the time of diagnosis through their treatment plan, which can include medical and surgical interventions, and then watching them through their recovery and then ongoing surveillance. From a personal standpoint, get to operate in several different modalities. So this gives me a lot of freedom to individualize a treatment plan based on patients' prior medical and surgical histories, as well as certain variables that would make one procedure, one approach more efficacious for them in the short and long term. Coming to the physician's office is no one's favorite thing to do, especially when you're coming to talk about some of the more sensitive topics that we discuss in my practice. So I think what I'm most passionate about is providing excellent personal care to my patients, treating any patient as if they were my own family member, but also help them leave the encounter more educated on the process. Coming to work every day and it not necessarily feeling like work. Being able to intervene on people when they're the most susceptible, most vulnerable, and then offer both a personal interaction and empathy, as well as offer a solution. I think that to me is what makes coming to work the most fun. And the immediate gratification in that regard from both my standpoint as well as the patient's standpoint is evident. And when we have that mutual understanding going through the process, coming to work becomes a very enjoyable part of my day and my week. Being relatively new to Memphis, we are exploring the area, and I have 2 young children, 5 and 7, and my beautiful wife is also a physician. So we're exploring the region. We enjoy taking walks at Shelby Farm, going fishing, traveling around the region and around the world, and we're avid Grizzlies fans and love going to explore our new home and new city.